So, if you're dealing with pain that just won't quit after back surgery, you're in the right place. We're going to cut right through all the confusing medical jargon and, those vague reassurances. The goal here is to build a clear map from where you are right now to a real, actionable plan for what comes next. Okay, let's just dive right in.
Man, this quote, it just gets right to the heart of the frustration, doesn't it? It's that whiplash, that incredibly confusing and lonely space where the clinical reports just don't match up with your daily reality. You know something is wrong, but all the official evidence everyone's looking at seems to be saying, nope, everything's fine here.
And this is what we call the post-surgery paradox. It is an incredibly common and, let's be honest, maddening situation where you're being told your scans look acceptable, but your body is basically screaming a completely different story. So let's really dig into why this happens and what it actually means for you. And that feeling, that very specific sense that your body just isn't cooperating anymore, it is 100% real. It is not just in your head. The source material for this explainer uses this incredible phrase, feeling like a malfunctioning marionette by late afternoon. This journey isn't about proving you're in pain anymore. It's about figuring out the mechanism behind that feeling. Okay, let's talk about the name itself for a second. Failed back surgery syndrome. Wow, it sounds so harsh, right? Like a final judgment has been passed. But we have got to reframe this. This is not a verdict on you, and it's not a verdict on your surgeon. Think of it as a clinical starting point for a brand new phase of problem solving.
So what is FBSS really? It's just a label. It's a term for a situation. All it means is that the first surgery didn't get the whole job done, and the reasons for your pain are probably more complicated than anyone first thought. And this is the most important part. It means this is a planning problem, not a personal failure.
And this shift in mindset, it's a total game changer. You go from feeling like you're on trial, having to prove your own pain, to becoming the project manager of your own recovery. You stop asking what went wrong, and you start asking a much, much more powerful question. Okay, what is driving my symptoms right now? And believe me, that changes everything.
So, to navigate this new territory, you're going to need a new map. And that map is built on 3 fundamental truths. 3 critical shifts in thinking that can completely change how you approach your recovery and how you talk to your doctors. And this quote just nails the first truth. Your imaging, your MRI, your CT scan, it's a super important clue, but it is not the final verdict. Just because the scan doesn't show a 5-alarm fire, it doesn't mean there isn't smoke. Things like scar tissue, nerve irritation, maybe some subtle instability, they don't always show up bright and clear. Your symptoms are the most important piece of evidence here, period. Okay, truth number 2 is so important. A lot of the time, the pain you have after surgery is a completely different character from the pain you had before, right? Maybe that sharp electric pain down your leg is gone. Great, but now you have this deep, relentless ache in your lower back. Trying to use the old solution on a new problem is a trap. We have to identify the new villain to pick the right strategy to fight it. And finally, truth number 3. Any plan that only works on your good days, that's not a real plan. That's a performance. A real strategy has to survive the bad weeks, so you need a 2-speed approach. For good weeks, you have a protocol designed to make progress. But for the bad weeks, and trust me, there will be bad weeks, you need a totally different protocol, one that's focused on stability and just gentle maintenance. And you pre-decide your red flags. When do I rest and when do I call the clinic? That removes all the guesswork when you're hurting the most.
Okay, so how does all of this translate into actual, concrete action? Because when you're in pain and you're feeling stuck, the last thing you need is another lecture. What you need is a menu, a clear list of real, tangible options. So here are the 5 main pathways forward. I want you to think of this like a logical ladder. You don't just jump to the top rung. You start with the most fundamental step of all. You hit pause and you reevaluate. You work to refine the diagnosis to match your current symptoms to a specific pain driver. From there, you move to step 2, managing those symptoms with targeted, non-surgical care. If that's not enough, maybe you consider selective interventions, things like injections that can both diagnose the problem and treat it. Then, for certain types of nerve pain, you could explore modulating the pain signals themselves. And only way at the end of this process, if a clear, obvious structural problem is found that perfectly matches what you're feeling, only then does revision surgery even get discussed. See? Each step builds on the one before.
Now, let's zoom in on two of those bigger options, revision surgery and neuromodulation. It's really important to know they're designed for very different problems. Revision surgery is for when there is a clear mechanical issue, something you can point to on a scan that directly explains your pain. Neuromodulation, on the other hand, that's often for persistent nerve pain, where the goal isn't to fix a structure, but to actually change the pain signal itself. The big takeaway here is that it's all about matching the right tool to the specific driver of your pain.
So there's the map, but what can you do right now, today? This last part is all about turning these ideas into a powerful, practical tool you can use to make your very next doctor's appointment way more productive. This is your 15-minute prep plan. Before you walk into that office, get crystal clear on these 4 points. When you can walk in and say, my pain is mostly in my back, it gets worse with standing, and I'd like to understand, is our plan right now about reevaluating or managing? Wow! You immediately become an incredibly clear, high-signal patient. It focuses the entire conversation and helps everyone make better decisions.
So let's end with this thought. Your job is no longer to convince someone that you're in pain. They know. The goal now is to become a partner in the investigation, to help your team match your specific symptoms to a specific plan. The power is in the questions you ask. So what's your first one going to be?